on a night shift. So I figured I'd tell you guys kind of what we do in a code blue and just kind of how intense that can be. So first responder finds the patient and calls for help, begins compressions if they find no heartbeat, no chest rise, that kind of stuff. Then we call the code. So we dial the code number, we repeat the code twice, and then a ton of people come running at us to help us, and we all kind of form a line. The doctor runs the code, so he kind of is shouting out all the things we need to do. My job as an LPN is to simply deliver compressions and help where I can. Sometimes that's like picking stuff up, sometimes that's cleaning up as we go kind of thing, without getting too gory about it. Hopefully we're bringing that patient back. So at that point it's kind of like a silent celebratory kind of feeling in the room. And then of course on the flip side of that, when we don't, it really shakes you up. In one of the hospitals I worked at, there was a lovely housekeeper that anytime this person would hear a code called, would run to the code with water and juice and set everything up so that when we walked out of that situation, we had something cold to drink, because it's absolutely exhausting to do CPR. We do 2-minute rounds and then we switch out, ideally. And it just like makes you sweat. So usually you're changing your scrubs. Usually you want to go change your scrubs because they're pretty gross after, all sweaty and shit. And then after that, you kind of want to take a little minute for yourself just to regroup before you go back and start to see more patients. Of course, in really odd situations, sometimes we do a code and run to another one like minutes later. So sometimes those, like when you get a few in a shift or even 2 in a shift, even 1 in a shift, it shakes you up. It does. And my first code, I did have some PTSD. I was having some nightmares about kind of like the experience of it. I was feeling like, oh my gosh, did I do everything I was supposed to do? And of course, in that situation, we did do a debrief with the doctor, and I got a chance to chat with him, and he like assured me like, hey, you did a great job. And so just kind of hearing that the first time, I was like, okay, I can do this again. You know, this is why this works, not for everybody. But that's what we do in a code. And sometimes we have to rip family members out of the room. The reason we do that is not to be cruel, not to be mean, not to take them away from their loved one, but it's so that we can do our job. And so that we're not traumatizing that patient further. Say the person doesn't make it and they watch them die as we're working on them. That's pretty terrible. Unfortunately, it does happen, but we do our best. We really do. It's a real team approach when we do these things, and I think there's a lot of support we give each other after and during. One of the things I saw in a few codes that I did was just somebody shouting out in the corner of the room, like, good compressions, deeper compressions. Do you need the bed adjusted to your height? These are all awesome things to do. Awesome things to do, because it really helps the person who's actually doing the CPR. In some newer facilities, we're seeing what we call the Lucas, which is super cool. Not for every patient, not appropriate for every patient, but for the most part, it's a pretty useful piece of equipment. And what that does is we strap it to the patient and it delivers compressions so we can do our jobs around them, around the compressions, right? So yeah, that's what we do in a code.